it has to do with social, it has to do with psychological, and of course, even spiritual aspects of rehabilitation.
One would be particularly curious as to how are people in Amaudo being rehabilitated? What is the process? Is there a clinical approach to it? And other than the communal living and the rest of it? So maybe you should help elaborate on that.
Amudo's approach in rehabilitation and treatment of people who have mental health problem, especially those who are rehabilitated at Amudo, is a holistic approach. What I mean by holistic is that it has to do with medical, it has to do with social, it has to do with psychological, and of course, even spiritual aspects of rehabilitation. So these things put together, we cannot do rehabilitation without talking about the social life of somebody, the environment of the person. And in Amudo, that is why Amudo is a community. So you are in an environment that the environment of Amudo addresses the social problems, which I have already listed before. That is activities of daily living. Sometimes somebody, you can know the sight of somebody who is mentally ill and homeless. Some of them have not taken their baths for over 2, 3, 4 years. They have not cleaned up, basic cleaning up, and you bring them to the center. The focus is not majorly at that time on what medical can do. The focus is on the social. Are you getting it?
Yes.
So you may not be even thinking much about what medicine you are going to give. You have to look at the person's social life. What is the appearance? This person has not taken his or her bath, and you know how discomforting it will be if somebody has not bathed for a long time. And this person is wearing rags, sometimes multiple rags. And so what we do is that we do the social aspects, cleaning up this individual. Cleaning up has to do with the nails, the hair. And when somebody who has had dread hairs because of the illness, when you remove the hairs, there is fresh air that enters. Then the clothes are changed and the person is battered, supported to do that. Sometimes you see a lot of things that is not something we can talk about. Sometimes somebody uses up to 3 pails of water, 4, 5. So before you get the skin, and these are supported by staff, and you can see the freshness that comes to that person's life when that cleaning up has taken place. Now, we should also remember that these people are individual, they are human beings. They feel the discomfort of not having taken their bath for a long time. They feel it. Now, having been refreshed, now you look at them, is there any physical wound like ulcer in the body? So the body is examined. Has this person come with any wound? Has the person come with any pile or anything? Has the person come with any hemorrhage? Is this person is it a woman? Is it in the period, menstrual period? These things, is there any kind of body, deformity that you can record? We take note of all these things. Now, this is when you now assess what is the physical, nature of this person, so that you can know that, because we have seen some of them that because they are vulnerable on the street, they have been wounded in one way or the other, and they are carrying the wound. Sometimes you see that it has become very, very bad with bad odor, and what we do is that we initiate treatment of those, wound or whatever at that time, so that we can bring back comfort to this person. And it is on the process of doing this that you will begin to note the person's behavior. Mental illness is a behavioral issue. So if this person is talking to self at random, and if the person is talking, what kind of speech? Is it contextual? When you place it within time and place, does it rhyme? So, what is the person seeing? If the person is seeing certain things that we are not seeing, is it contextual within the time and that. So we take note of these things. Is this person having the habit of running away? Is this person trying to exhibit some form of, aggression? So we take note of all these things. And if this person is not violent, we don't rush to begin treatment immediately. Because by the time this person has been engaged in this community, that this person is taken to church for worship, is taken to the dining with the accompaniment of others, is taken to other places for work, and we don't see any form of violence or aggression, then we will now begin to carefully note the issues of mental illness that require medication proper. Because if it is something that has to do with social intervention, psychological intervention, there may be minimal drug, that could be given, and this person will do well. So if you rush immediately because you brought somebody from the street, what is the judgment you have to begin treatment? What do you have as an information? Because you don't know this person. So you will be limited in the information that you have. No family member have come to tell you when this illness started, how the person is presenting. So Amaudo allow this person in the community. It is the community now that will observe the person's behavior. Now, when we now go to clinical review, assessment, the things that members of staff have observed will be brought on table for the clinician, the psychiatric doctor, or the psychiatric nurse to be able to look at these things now and observe the person, and of course interrogate that person. By the process of interrogation, the professional will now make a good decision which will be in line to the benefit of the person, not for any other person, because it has to be for the benefit of this person. The best thing that will occur to this person, you have to take into consideration what kind of body weight does he have, what prescription are you going to make, is it going to be well for the person's physical health, so that when we begin, it would have been the best for this person. Note that before now, for them that are females, would have tested for pregnancy if somebody came from the street with any kind of pregnancy, and what would be the time, and would have tested for HIV. And these are basic tests. And when the person goes to the clinic for review, the clinician will now take the vital signs, the pulse, and of course the temperature, and of course uh, um, the blood pressure, and anything that is needed, so that proper reports and information will be there. Then we set on the cell and continue to observe and to plan. And our war round at Amaudo is not a war round of the doctor alone and the nurse. It's a community war round, because we know that mental illness, the presentation is within the community, is within the society. Information that the doctor needs to be able to make good judgment for prescription, he or she may not observe it. It is the family member, if the person is in the family, or somebody in the society that will observe. And if proper information is made available to the doctor, he will be able to do what? Make proper prescription. So it is a bit away from the hospital setting, where the doctor is interrogating a patient and there may not be any other information, and the doctor is left alone by his own judgment, by what he can decipher. And you know that sometimes it takes a long of trial and error before the right medication can be got. Whereas at Amaudo, you have a whole pool of reports: report from the kitchen, report from the chapel, from the chapel activity, report from the games activity when there is recreation, indoor or outdoor, report from the farm when there is farm work, report from when there is community activity, report when there is time for refectory. So because sometimes if somebody who has a mental health problem, who is on the street, has poor eating habit, what we mean by poor eating habit is that you are supposed to eat from the table, others are eating from the table, but the person chooses to go and stay on the floor. That's a behavioral issue. And because he or she have been eating from the dustbin, he's not yet comfortable with eating from the table. Are you seeing the issue? So these things are reports that we gather from all the segments of the community at Amaudo. And then we look at what is this person's living pattern. Does he or she live in the room that have been assigned to him, or does she leave the room and go and stay in the inside the corner of the bush? These are reports that we get. And then proper, planning will be made by the clinician, whereas the social plan will continue and the psychological plan will continue. At the end of all these things, we assemble the report, and now from ourselves, our observation, know whether this person is able and mentally stable, socially acceptable, and able to support himself and live in the society before we can now say, yes, this person can go home.